I'm Joe Chili. You can listen to me mornings on The Big Weck. Joining us today on The Big Weck's Buffalo on the Rise is Dr. Kaplansky, and I want to welcome you to the show today. I'm impressed by some of the things I see about you. You know, we do background, obviously, before we do a program like this. So I wanted to look up some things about you. First off, you started in business with a friend of mine in Niagara Falls, which was a while ago, but all of your certifications and things like this, you'll have to explain some of these things to me, because if I look up dentists in general, I see a couple of things. Graduated from here, did work here, or whatever, but you're board certified in implant dentistry, diplomat of the American Board of Oral Implantology, fellow at the American Academy of Implant Dentistry, fellow International Congress of Oral Implantologists, fellow Academy of Dentistry, certified Zaga Center, which is kind of like a mystery to me. We'll have to ask you about that. But what do all these things mean? To me, this means that all dentists are not the same, right? I mean, but when you start looking at all these things, how long did it take to get these? And was it something that you planned originally, or did you say, these are the things I'm going to go for as far as certifications?
Well, first of all, I'd like to thank you for inviting me
Sure.
to the program. It's my pleasure to be here with you. It's a lifelong journey, really. This obviously took years to accomplish. And unfortunately, that's what we see often now in practice, is many younger dentists just fresh out of residency are doing these procedures, and they probably don't have enough experience yet to perform them.
When you start talking about things, and you start talking about implants, because it's something specifically that you do, is there something that they teach you in dental school with regard to implants? You know, something that all dentists do. And how did you move past that to come up with your own teeth now method?
Absolutely. So in dental school, you get some really basic rudimentary kind of education on all aspects of dentistry, on all the different procedures. So they can't really focus on anything too in-depth. And then after you graduate, that's when you expand your knowledge, then you kind of go more into the areas of your interest. So my area of interest was dental implants, and I really wanted to get much deeper knowledge in that area. That's how it all happened.
Dental implants, and I have a very basic knowledge of these things, so I'm going to ask you, but you know, you start thinking about things like bone grafts and the prep work that goes into this, and it sounds very invasive to me. And as just a normal individual, I like to avoid pain.
Absolutely, yeah. We all do.
So I mean, you probably look the same way. You probably looked at this and said, there's got to be a better way to do this procedure.
True. So traditionally, dental implants aren't new. So they've been placed routinely for probably about 30 years now, with a lot of data, a lot of research, and it's backed up by science. Now, traditionally, the thinking in dentistry was that you have to prep the site first. So if the site or the bone in the area is deficient, you have to build it up. And how do you build it? By grafting bone, either from a donor or from animals. You would take the bone, graft it in the area, and then grow the bone, then place the implant. So that basically means multiple procedures, multiple surgeries, a lot of time and healing, discomfort, obviously, and patients, had a very, very long journey for absolutely no reason. So what we did, again, based on the current research and the modern science, is we changed the tactic a little bit. So we looked for solid native bone instead of using grafted bone that, unfortunately, a lot of times later turns into mush, and it's not even usable. We use patient's native bone, which is stronger usually, doesn't require additional surgeries, and gives us better and faster results.
Is it a long, involved process?
The Teeth Now procedure that we kind of created is very streamlined. You literally, in 24 hours, you take patients from either no teeth or decayed, non-restorable teeth to permanent teeth. 24 hours.
Is it something that lasts the entire life, your entire life?
It can. It depends on a lot of factors. Most, again, scientific research shows us longevity of dental implants anywhere from 15 to 25 and more years. But a lot of it depends on patients' general health, which can change throughout their lifetime, and also on the maintenance, on care and maintenance. So we do insist that patients come back for routine hygiene so we can check things and clean things.
Are you trying to tell me that people don't generally take care of their teeth?
Sometimes they do.
You know, flossing is a big thing. You're trying to keep your teeth. I think that this is fascinating in itself. I think the fact that it's less invasive, your procedure, is a big thing. Not just, you know, for myself. I mean, I hate to sound like, you know, oh my, you know, I don't want to have to go through this. But, you know, I had parents and grandparents that went through dentures, and many, many different kinds of dentures, and dentures that didn't seat right, and dentures that were constantly slipping, or whatever the case may be. So
we see it very common. It's a very common experience. Patients really hate their removable appliances. So I'm yet to see a patient who is happy with their denture. So that was another push in creating a process that would give people permanent teeth. So the teeth that they wouldn't have to remove every day to clean. Teeth that wouldn't hurt them when they chew, teeth that wouldn't fall out when they laugh. That's what we did.
So if you hate your removable, you know, appliance, you'd want to give Dr. Kaplansky a call. Dentistry by Dr. Kaplansky, 8038 Rochester Road in Gasport. Phone number 716-772-7500. drkaplansky.com is the website, drkaplansky.com.
Sponsorship and promotional consideration for the preceding segment was provided by the following.